Congressman Peter Roskam from Illinois' 6th District. How do you respond to what Speaker Pelosi said about health care?
Well, I think the Speaker, is continuing to lay out a plan and an agenda, but what I think is more interesting is looking at sort of the things that the Speaker didn't say. In other words, it strikes me that there's a real difficulty that the Speaker is having and other Democrats in the House of Representatives in rolling out their plan. This is a plan that, if it's so fabulous, if it's so terrific, and if it's so great for America, where's the disclosure of it? It was supposed to come out last week. It was supposed to come out last Friday. We were supposed to see it yesterday, and now we're being told it's soon, and very soon we're going to be seeing it. And I think that's an indication that, notwithstanding sort of some of the bumper sticker language that the Speaker uses to describe sort of truisms about weakness of the healthcare system, I think as they're trying to roll it out, particularly after the cap and trade vote, it's clearly becoming much more difficult than they anticipated.
What is your role right now in the Republican Party as your party looks at health care and what you'd like to see happen?
Well, I serve in the Ways and Means Committee, which is one of 3 committees in the House of Representatives that has jurisdiction over health care. Jurisdiction meaning it's coming our way. So the Ways and Means Committee is expected to have a markup this week. Now, again, that's been delayed in terms of timing. It was supposed to be a markup tomorrow, but the bill is yet to be disclosed. It hasn't quite been scored yet by the CBO, so we don't have a clear indication of what the cost of the proposal is. But I think what I'm trying to do as I'm approaching health care is looking at several themes. Number one, making sure that we enhance the doctor-patient relationship ultimately in our healthcare system. I think physicians practice medicine best when they're in close proximity and close relationship with their patients and aren't burdened necessarily by either insurance bureaucrats or government bureaucrats. Another area to concentrate on is to making sure that we continue to invest in medical innovation so that we, as Americans, get the breakthroughs that we need and that we're looking for. Another thing is to focus in on the actual number of uninsured. Oftentimes we're told that there's 47 million Americans that are uninsured. If you drill down into that number, you find out that while that is technically true at the time that question was asked, it's actually a much different number, and we can maybe get into that in some of the calls. And then finally, making sure that patients have a right to know, that patients understand where and how their physicians and health providers, what's their background, how successful are they. I think so. Those are some of the themes that we need to focus in on.
Our topic for the rest of the hour is health care and how health care legislation may shape up in the House. You can call us with your comments and questions for Congressman Peter Roskam. The phone number for Democrats, 202-737-0001. Republicans, 202-737-0001. Rather, Democrats is 0002. Republicans, 0001. And Independents, 202-628-0205. You can also email us your comments, journal@cspan.org, or send us a tweet, and that's at twitter.com/cspanwj. A recent piece in USA Today, this comes from today, it talks about how the American public is weighing in a Gallup poll on health care. It says one advantage for the president, a third of those surveyed say they trust him and congressional Democrats most when it comes to changing health care, compared with 10% who choose congressional Republicans. 45% trust doctors and hospitals the most. What do Republicans need to do to get out their message on their goals and priorities?
Well, I think a couple of things. Number one, and you're seeing this within the past couple of days here in Washington, D.C., there's at least 10 physicians who are Republican members of the United States Congress who are being very vocal and very outspoken on their concerns as it relates to the president's plan, particularly for a public option on health insurance. And they see that as a prelude to a single-payer system. They've been very vocal and I think have a great deal of credibility. I myself have met back in my district with over 150 physicians who are equally concerned about the public option and where that will take us as a country. Even this morning I exchanged emails with one of the doctors who's a policy person back in my congressional district. But I think it's interesting if you look beyond some of the polling where the president seems to be slipping, particularly in a key state like Ohio, where his numbers now have dropped below 50%. I think it is in part due to the high expectations that the president created during the campaign and his inability to deliver on actual things that make a difference to most Americans. What they see is runaway spending, and they're not seeing the stimulus that they thought they would see, and they're not seeing a wise energy policy that they thought they would see, and they're not seeing the type of health care system that they're hoping to see. Instead, they're seeing a big government mandate.
A story from the Daily Herald out of your hometown in Illinois talks about a recent trip you made out there, and you held a forum to talk to doctors, healthcare providers. What was the message you heard from them?
Well, the message really from the physicians who came, and again, this is about 150 physicians who came out in the middle of the day, in the middle of the week, and they were extremely concerned about the public option. And remember, these are physicians who have been practicing, and over the years, I think what many doctors have communicated to me is that the joy of practicing medicine has been robbed from them based on how the government tends to get too involved and really undercompensate them in so many areas. So in terms of physician compensation at Medicare or Medicaid is just a complete disaster. They are very concerned and very wary about another big government program that comes in and purports to save the day but actually underperforms.